Good morning, students. In today's listening session, we will discuss an essential topic in the field of electromedical technology, namely preventive maintenance of medical equipment. Preventive maintenance, often abbreviated as PM, is a systematic approach to inspecting, testing, and servicing medical devices to ensure they operate safely, accurately, and reliably. Preventive maintenance is different from corrective maintenance. While corrective maintenance is performed after a device fails, preventive maintenance is carried out before a failure occurs. The main goal of preventive maintenance is to reduce the risk of equipment malfunction, improve patient safety, and extend the lifespan of medical devices. Medical equipment used in hospitals ranges from simple devices, such as thermometers and infusion pumps, to complex systems, such as ventilators, patient monitors, and imaging equipment. All of these devices play critical roles in patient care, and any failure can have serious consequences. Therefore, preventive maintenance is a core responsibility of electromedical technicians. One of the key reasons preventive maintenance is important is patient safety. Medical devices often come into direct contact with patients or are used to support vital functions. If a device is not functioning correctly, it can lead to incorrect diagnosis, improper treatment, or even life-threatening situations. Regular maintenance helps ensure that devices perform according to their specifications. Another important benefit of preventive maintenance is equipment reliability. Devices that are regularly inspected and serviced are less likely to fail unexpectedly. This is especially important in critical care units, where equipment must operate continuously. Unexpected downtime can disrupt clinical workflows and delay patient treatment. Preventive maintenance activities usually follow a scheduled plan, which is based on manufacturer recommendations, hospital policies, and regulatory requirements. Some equipment requires monthly maintenance, while others may only need servicing every 6 months or once a year. Technicians must follow these schedules carefully and document all maintenance activities. A typical preventive maintenance procedure begins with a visual inspection. During this step, the technician checks the physical condition of the device, including cables, connectors, housings, and accessories. Signs of wear, damage, or contamination must be identified and addressed. Visual inspection is simple but highly effective in detecting early problems. The next step often involves functional testing. Functional tests verify that the equipment operates as intended. For example, a patient monitor may be tested to ensure that alarms activate correctly, displays are accurate, and controls respond properly. In infusion pumps, flow rate accuracy and alarm functions are commonly tested. Electrical safety testing is another critical part of preventive maintenance. This includes checking grounding continuity, insulation resistance, and leakage current. These tests are essential to prevent electrical shock hazards to patients and healthcare staff. Specialized electrical safety analyzers are commonly used for this purpose. Calibration is also an important component of preventive maintenance. Calibration ensures that measurements provided by medical devices are accurate and within acceptable limits. Devices such as blood pressure monitors, ventilators, and defibrillators rely on precise measurements. Over time, sensors and components may drift, leading to inaccurate readings if calibration is not performed. In addition to technical tasks, preventive maintenance also involves cleaning and disinfection. Medical equipment can become contaminated with biological material, dust, or fluids. Proper cleaning reduces the risk of infection and helps maintain device performance. Technicians must follow infection control guidelines when handling equipment. Documentation is a vital part of preventive maintenance. Every maintenance activity must be recorded, including the date, tasks performed, test results, and the technician's name. These records are important for quality assurance, audits, and regulatory compliance. Accurate documentation also helps identify recurring problems and plan future maintenance. Preventive maintenance programs are often managed using a computerized maintenance management system, or CMS. This system helps track equipment inventory, maintenance schedules, and service history. By using a CMS, hospitals can improve efficiency and ensure that no equipment is overlooked. From an economic perspective, preventive maintenance is cost-effective. Although it requires time and resources, it reduces the likelihood of major equipment failures that can be expensive to repair. It also helps avoid emergency repairs and equipment replacement costs. Human factors also play a role in preventive maintenance effectiveness. Proper training, attention to detail, and communication are essential. Technicians must understand equipment operation, maintenance procedures, and safety standards. They also need to communicate with clinical staff to schedule maintenance without disrupting patient care. In some cases, preventive maintenance tasks are performed by external service providers or vendors. However, in-house electromedical technicians still play an important role in supervision, coordination, and verification of service quality. In conclusion, preventive maintenance of medical equipment is a fundamental practice that supports patient safety, equipment reliability, and healthcare quality. For students of electromedical technology, understanding preventive maintenance principles and procedures is essential for your future professional role. By performing preventive maintenance correctly and consistently, you contribute directly to safe and effective patient care. Thank you for listening. I hope this session has provided you with a clear understanding of the importance and practice of preventive maintenance in medical equipment management. Answer the multiple choice questions based on the tape. 1. What is the main purpose of preventive maintenance? A. To repair equipment after failure. B. To reduce the purchase of new equipment. C. To prevent equipment failure and improve safety. D. To increase hospital profits. 2. How is preventive maintenance different from corrective maintenance? A. Preventive maintenance is cheaper. B. Corrective maintenance is performed before failure. C. Preventive maintenance is done after equipment breaks. D. Preventive maintenance is performed before a failure occurs. 3. Which of the following is mentioned as a major benefit of preventive maintenance? A. Reduced staff training. B. Improved patient safety. C. Faster diagnosis by doctors. D. Increased patient visits. 4. Why is preventive maintenance especially important in critical care units? A. Equipment is rarely used. B. Equipment must operate continuously. C. Equipment is simpler. D. Equipment requires no calibration. 5. Preventive maintenance schedules are usually based on A. Technician availability. B. Patient preferences. C. Manufacturer recommendations and regulations. D. Hospital location. 6. What is the first step in a typical preventive maintenance procedure? A. Calibration. B. Electrical safety testing. C. Functional testing. D. Visual inspection. 7. What is the purpose of functional testing? A. To clean the equipment. B. To verify that the device operates correctly. C. To check documentation. D. To reduce power consumption. 8. Electrical safety testing is mainly performed to A. Improve image quality. B. Prevent electrical shock hazards. C. Reduce equipment size. D. Increase alarm volume. 9. Which device is commonly used for electrical safety testing? A. ECG monitor. B. Multimeter. C. Electrical safety analyzer. D. Defibrillator. 10. Why is calibration important in preventive maintenance? A. To improve device appearance. B. To shorten maintenance time. C. To ensure measurement accuracy. D. To reduce cleaning requirements. 11. Cleaning and disinfection during preventive maintenance help to A. Increase equipment resale value. B. Improve battery performance. C. Reduce infection risk. D. Enhance alarm sensitivity. 12. Why is documentation an essential part of preventive maintenance? A. To entertain auditors. B. To support quality assurance and compliance. C. To reduce technician workload. D. To eliminate the need for CMS. 13. What does CMS stand for? A. Central Medical Monitoring System. B. Clinical Maintenance Management Software. C. Computerized Maintenance Management System. D. Clinical Medical Maintenance Service. 14. From an economic perspective, preventive maintenance is beneficial because it A. Eliminates the need for technicians. B. Increases equipment purchase costs. C. Reduces major repair and replacement costs. D. Requires no resources. 15. According to the tape, which human factor contributes to effective preventive maintenance? A. High equipment prices. B. Advanced hospital buildings. C. Proper training and communication. D. Frequent equipment replacement.